Hi, Dr. Leff. We've talked about why there's a need for hospital at home. Now I'd like you to tell me how it actually works. Let's just say a patient has acute congestive heart failure, or a urine infection, or a flare-up of COPD. Can you tell me what happens when a person gets hospital at home?
Usually that person will show up in an emergency room, in a traditional emergency room. That person will get the usual assessment that an emergency room will provide. The person needs to meet the threshold to require hospital level care. So the thought experiment is if that person in the emergency room with a COPD exacerbation, if hospital at home did not exist at that moment, that person would absolutely be admitted to the hospital. But then they can't be so sick that they need an intensive care unit or are going to need things that a hospital at home cannot do. So they're in that category. Oxygen and respiratory therapies at home. You're going to get nursing visits at home. You're going to get physician visits in home or virtual at home. If you need IV medicines, you'll get IV medicines. If you need X-ray and blood tests, we'll get you those. If you need physical therapy and occupational therapy, we'll get you all of that stuff. It'll all come to your home. And you're basically met at home by a hospital at home, usually a nurse, who kind of settles you in and does a pretty extended visit. That first visit by a nurse is usually 2 to 3 hours. The program is explained again. The patient and family member are re-educated because these are the kinds of things you can never say too many times, especially for something that's new and unfamiliar. And you start seeing things come to the home, the oxygen concentrator and the nebulizer machine and IV antibiotics if they need a dosing once you're home. The physician will make a visit. During that time, pretty much all programs have the ability to communicate in an instant with the patient. Many are using Televideo capability now, so the patient can reach out at any moment. And for many programs, they can reach in and get a bird's eye view of the patient. And that's actually a great, great advance. Because as a physician, someone calls and says, I'm not well. The most important thing is, how does that patient look in the moment, right? Are they sick? Are they not sick? Do they need emergent intervention, or is this something that can wait 20 minutes, 30 minutes, or 3 hours? If someone needs an urgent visit, many programs will send out a clinician, or many programs now are collaborating with paramedics who can be there very quickly. And the paramedics can do a lot. They know how to do urgent IV infusions. They know how to do an EKG. They have a lot of top-notch skills that really come in handy in those urgent moments. And so every day the team huddles, reviews the list of patients. They figure out, Warren's got a COPD exacerbation. The nurse is going to go in the morning. The doc is going to go in the afternoon. They need an antibiotic at 2:00. The nurse is going to do that one too. And things are coordinated. And then after 2, 3, 4, 5 days, Warren gets better and he's discharged. Many programs are, using sort of a post-acute, keeping eyes on that patient, making sure they don't get readmitted. If someone needs skilled home healthcare after that acute phase, they're referred for typical skilled home healthcare, but that happens at home where the patient has been. And medication reconciliation, figuring out what medications the patient was on and now what they're going to be on is done for real. Because you can do it at the kitchen table with the medicines, unlike, the relative science fiction that happens when someone is leaving the hospital and you're working off of a list of the medicines at home, and it's always a royal mess up.
So, Bruce, on an average, during the acute phase of hospital at home, on average, is there somebody usually coming to the home every day or?
Oh, yeah. So nurses, usually at least twice a day, and physician contacts at least daily and as needed. Yeah, so people are getting stuff. If the patient needed help now because they were acutely ill, say getting out of bed and getting to the toilet, we could provide a home health aide, which is a very important function. But compared to the price of staying in the hospital, the hotel hospital, the hospital is a very expensive hotel, and to provide that kind of support in the home is actually inexpensive compared to the hotel price of the hospital.
Some of my patients would talk about being in the hospital for what they call tune-ups. They'd say, a tune-up of my heart failure, a tune-up of my COPD, sometimes tune up for cellulitis or even a pneumonia or stuff like that. But I wanted to know, Bruce, how often is it that people who are on hospital at home actually do become seriously ill enough that they actually do need, to be placed in the hospital?
Yeah, it's a great question. So you're getting at the concept of what's called an escalation.
Yeah.
Right. So someone's starting off at home, and for one of two reasons, they need to go back to the hospital. One, their condition deteriorates, and the hospital is just a better place for them because you just need more than what you can do at home. And there are limits for sure. The other is the patient just wants to go back to the hospital. So we always told patients, you're in hospital at home, anytime, day or night, all you have to do is whisper the words, I would like to go to the hospital now. And we will get you into the hospital. So that rate, if you look in the literature, that rate, depending on the study, is usually somewhere around 4 to 7%.
Very low. Yeah.
It's low.
One last thing about hospital or home is you really are treating the patient and the family more than just the disease. I mean, you're going to see what the home environment's like, and you can tell exactly what's going on and treat appropriately for that.
Absolutely. So, there's just nothing like being in someone's home. I've had clinic patients that I've seen in the outpatient clinic for years. And, many times I'll end up making a house call. And it's really not until I've made that house call that I have any understanding whatsoever of what's been going on in their life or why taking medicines has been a challenge or, why the function has been, their ability to do things. But, people will often, they want to project that they're doing well.